and welcome to this informational seminar for the Corinthian Plan and questions and answers. I want to take care of a couple of housekeeping items before we start. First of all, if you want or need Spanish translation, then please go to the bottom of the screen to a globe where it says Interpretación. So for translation, go to the bottom of the screen and look for the globe. There's also in the chat, you can find information on how to find translation. Second is, if you have questions, please put any of your questions in the chat box and we'll make sure that those questions are answered. And we received a couple of them before the webinar as well. I want to welcome you again to this webinar, informational webinar for the Corinthian Plan. My name is Duncan Smith. I am the director of the Corinthian Plan. I'm Mennonite Church USA staff. You may be here because your congregation is currently participating in the Corinthian Plan, and we welcome you and any of your questions. And if you have any comments on how the plan is working for you, we would welcome that. You may be here because you are not participating in the Corinthian Plan, but interested to hear more about it. We welcome your questions and comments as well, and anything that would be helpful for you to know. The format will be as following. After my introduction, there will be three other panelists that will speak. They will each give information regarding the plan, and after they speak, the three of them, we will open the webinar up for your questions and your comments. If you have not submitted questions prior to the webinar, you can enter those into the chat, as I said, and we will see that those questions are answered. Just a couple of introductory comments. Mennonite Church USA sponsors the Corinthian Plan. It began in 2010 following a mandate from the 2007 Mennonite Church USA Delegate Assembly to the Executive Board of MCUSA. And the mandate was to create a health coverage option for congregational and conference staff. Mennonite Church USA is the plan sponsor. The Corinthian Plan CEP health coverage is self-funded coverage. There are other benefits as well that we will talk about this evening. Everence, an agency of Mennonite Church USA, is the third-party administrator, and we use Highmark Blue Cross Blue Shield for the provider system, claims, and participant support. We have two persons from Everence on the panel tonight, Patrick Tibbs and Denise Henke. They will introduce themselves and give a description of the plan or the work that they do. The other panelist is Ingrid Friesen-Moser. She is MCUSA contract staff for the Corinthian Plan, and she is our wellness coordinator, and she will give a description of the wellness incentives. As you may know, there are also area advocates in each region, and you may have spoken to them. They are available to help you with your questions and concerns and refer you as needed. You may have spoken or emailed to them. Their contact information, along with Denise and myself, is on our webpage. There is one area advocate that is on this call. One has just resigned, and then we have one other. So I want to introduce Joe Christoffel. Joe is area advocate for what I will call the Mid-East part of the country. It's not quite accurate, but it goes from Illinois basically to Western Pennsylvania. He's been with the plan basically in various forms for about 12 years. So Joe's a very valuable part of our team. Teresa Pickens is on the call as well, so I want to introduce her. She is an area advocate for the central part of the country or the Midwest. There's Teresa. Give a wave there, Teresa. She has been a part of the team for several years now and is also a very valuable part of the team. Teresa is also working with the conferences on the James Miller, who you might know, has resigned from his position as area advocate. So glad to have you here, Teresa. Next, I want to pass this on to Patrick Tibbs and the Everence staff. Patrick has been with Everence for many years in different capacities and is a valuable part of our partnership with Everence. So Patrick, I'll turn it over to you, and then he'll introduce Denise, and also there's one other staff person that's a part of the team he will introduce.
Thank you, Duncan. Well, good evening, everyone. It's good to be with you, or good afternoon, depending on where you're at. Again, my name is Patrick Tibbs. I am the operations manager for the third-party administration here at Everence, and it is our pleasure to serve congregations and members of the Corinthian plan. And my role is that I oversee operations and work very closely with Duncan and the area advocates on the plan, and then also our team. Joining me this evening is Denise Hinke, who she'll be speaking a little bit later. Denise is our TPA sales and service assistant. She works with Duncan and the area advocates, congregations, and members very closely and answers questions about the program, and has been working with Corinthian Plan for many years. Dina Roth is our TPA service representative. Dina works with congregations and members on billing and enrollment and plan questions, and has been involved with the Corinthian Plan for several years. And just appreciate their assistance in their work. So thank you. What I'd like to do now is I'd like to talk about just a brief outline of the plan benefits and just review some of those benefits with you. Congregations may choose up to 4 programs, deductible options that are available. They'll range from a minimum of $1,400 for single coverage, or $2,800 for family coverage, being the lowest deductibles, and the highest deductible for 2022 being $3,000 for single and $6,000 for family. The plan has comprehensive benefits where it will cover major medical. It will also cover prescription drugs and doctor's office visits. The plan has an emphasis on first dollar benefits for preventive, meaning that to encourage plan participants to practice prevention and be knowledgeable about their health, the plan will pay 100% of some services immediately without requiring the individual to meet the deductible. For example, those preventive services could include immunizations or physical exams. As Duncan mentioned, Highmark Blue Cross Blue Shield is our partner, and they administer claim payment, and they also are the network that the plan uses to access doctors, hospitals, or facilities. Highmark will assist in reviewing hospital bills, negotiating fees, managing large claims, and they also take care of pre-certification. Coverage for both credentialed pastors and other non-credential employees and their families is available. Denise will talk a little bit about that in a few minutes. The program also has available for congregations and members is to have what's called a health savings account and a health reimbursement arrangement. A health savings account is a bank account that congregations are encouraged to deposit money into, where employees can use that money to reimburse themselves or to pay a provider, a hospital or doctor for services. A congregation or a member could also enroll in what's called a health reimbursement arrangement, where an amount of money is set aside for the member And if there are services that the member accesses, then the health reimbursement arrangement would pay for that service. There's also what's called a flexible spending account for members to use. So if they want to pay for medical expenses on a pre-tax basis or for dependent care, they would have that available as well. The Corinthian plan has a robust wellness program. Ingrid will talk a little bit about that in more detail, but it's to support healthy lifestyles for individuals. The program encourages employees and spouses to see their primary medical provider for annual or wellness exams. Also available is life insurance, accidental death and dismemberment, and long-term disability coverage that are mandatory for participation. We also have available vision and dental benefits that congregations can offer to their members as a part of the program. The vision is through what's called Vision Service Plan, and an individual can go once every 12 months and have their eyes checked. If they wear glasses, have glasses as a part of that program to be for a reduced cost or to have contacts. The dental program, which would be available for individuals and families, is also a wonderful benefit. With that, I will go ahead and turn it over to Denise, and she'll talk a little bit about participant support, enrolling, things of that nature. Denise.
Thank you, Pat. Yes, my name is Denise Sinke, and it is good to be here with you this afternoon, this evening. My role here at Everence is to work a lot with the congregations. I receive phone calls a lot from them when a congregation has maybe a new employee wanting to enroll, helping them understand eligibility. The one thing about the eligibility is there's eligibility for credentialed with pastors or staff, which is basically an ordained or licensed in their area conference of the Mennonite Church USA. And their eligibility is that they are giving at least 20 hours per week. And the other piece of it is paid at least 10 hours per week to be eligible for the life and disability benefits. For the non-credentialed staff, they would be working and paid at least 30 hours per week. So that's the difference in the eligibility between the credentialed and non-credentialed staff. Now, there are some special arrangements that have been made previously when they were part of the plan prior to the Corinthian plan, but that's where the eligibility is for the Corinthian plan. I will also work with congregations that are participating that may not have any eligible employees, and they're looking for what the rates would be for a new hire. We provide the illustrations for all four of the plans that Pat spoke about, and for the life and disability and dental and vision, so that they have an opportunity to make that choice based on those illustrations and the employees that are participating. We provide the enrollment forms that for the health plan and the life and disability. And also we work with cancellations. And when a person cancels, they are offered continuation of coverage, which is very similar to COBRA, which is an 18-month continuation for the health coverage. So we will work with employees if they're experiencing that and needing to have that type of coverage after they've left work or left service with the church. And that's also a carryover that they can have between congregations. If there's a time frame that they're at one congregation and may have a couple of months until they're at their next assignment, that will keep continuous coverage for them. And we can go into that if there are specific questions about that. Another piece that I work with the Corinthian plan are the renewal packets. And we send out renewal information, which this is the time of year we're getting ready for renewals. So we send out a very robust package so that you know what all the possibilities and options are for the current employees, and this is also time for open enrollment if employees haven't enrolled, or for a congregation that is eligible that wants to come in during open enrollment with coverage starting on January 1. So those are a pretty quick overview of the type of things that we work with. Between Dina and I, we work with that. Dina will work with the congregations or the employees when they're enrolled, after they've been enrolled, work with the billing, enrollment. And she also works with the offers of continuation of coverage. So that's basically that piece that I work with the Corinthian plan. So turn it back to Ingrid, I guess you're the rep. Or Duncan.
Duncan, were
You're
you?
muted.
You're muted.
I have to unmute myself. Okay.
Yep, you're still muted.
There's a question in the chat, Denise. Thank you. There's a question in the chat that pertains to what you were talking about that we might as well go to.
Okay.
Does AD&D coverage for non-credentialed staff also require 10 hours of work a week? So maybe clarify the hours and
Sure.
also the pay thing.
Right. In order to be for non-credentialed staff, they would be working and paid 30 hours per week to be eligible for the life, AD&D, and long-term disability and the health coverage. For credentialed employees, they need to be working, well, they're working at least 20 hours or giving 20 hours and then paid for at least 10 hours to be eligible for the life, AD&D, and long-term disability. So non-credentialed would be the 30 hours working and paid.
Thank you.
Yeah.
And part of the reason for that difference is at the beginning of putting the Corinthian plan together, we wanted to support congregations such as church plants where the pastors were maybe paid less than half-time or three-quarters time. And so that's why there was a difference in the status between the credentialed and non-credentialed, as well as the life and disability. So Barry, I hope that answers your question. If it doesn't, please put a note in the chat. Thank you. Okay, we'll move to Ingrid. Ingrid Friesen-Moser is our wellness coordinator for the Corinthian plan. She has been for the life of the plan for 12 years. She was at Everence when it was being formed, so was around the edges when the Corinthian plan was being put together. She is a, I don't know how to say it exactly, Ingrid, but licensed dietitian and works in Goshen at the Maple City or Maple Valley clinic. So
Maple
Ingrid.
City Healthcare Center.
Yeah.
Yeah. All right. Thank you so much. I'm glad to be with you. And like Duncan said, I'm Ingrid Friesen-Moser, and I have been with the Corinthian plan since the very beginning of the health plan. And it's been my pleasure to work with pastors and church workers as the wellness coordinator. I am a dietitian nutritionist, and I've spent most of the last 30 years working in health and wellness. And I'm also a pastor's wife, and I have my master's degree in Christian formation from AMBS and Elkhart. And it's this intersection of faith and our spiritual disciplines and our health habits where I think we have an opportunity to see God at work in our lives. And it's also this intersection where we can begin to actually live fully in the body that we have. We may not have the body we long for, or the body we wish we had, or even the body we used to have in a younger version of ourselves. But I firmly believe that living fully in the body each one of us has today can bring joy and newfound strength, even in the midst of pain, illness, and suffering. And the wellness incentives are designed to help participants find this intersection where we can begin to live fully and engage our well-being with depth of relationship, with intention, and with reflection. The wellness benefits have been a core part of the health plan since the very beginning, and I continue to be really grateful to the Corinthian Plan Board for the ongoing support they give to this aspect of the health plan. Over the last 12 years, we have given back to plan members more than $500,000 through the annual wellness incentive. So those with active health coverage, as well as those with waived coverage and their spouses, regardless of whether they are on the health plan or not, are eligible for our wellness incentive. And you can learn more about the wellness incentive specifics and find the documents that you need to participate on our Corinthian plan web pages. And I will say just a little bit more here about them, however, so you can get an idea of what the wellness incentive is like. There are 2 parts to the incentive and the potential to earn up to $300 per person or $600 per married couple annually. Our wellness incentive cycle runs from March 1st to the end of February the following year. So it's just off the calendar year. And the wellness incentive activities are the following. So part 1, you need to verify that you've had a routine wellness exam. And after having your exam, submit the required form to Everence. This lets us know you completed the activity, and this will earn you $150. This activity is designed to support you in developing a strong relationship with your medical provider. And this is because we believe that the best medical care and decisions are made in the context of a strong relationship of mutual trust. And then part 2. So in part 2, you complete one of the following 4 options. So 1, you can choose to engage in a one-time confidential well-being conversation with our own MCUSA well-being specialist. And this takes place over the phone or on Zoom. It's based on your preference. And our well-being specialist is a trained spiritual director, but also a nurse with a holistic health background. The second of these 4 options is you can create a personal well-being plan. This is a written document, and you engage first in some thoughtful reflection, and then you write out on the form what your plan is, and you follow the question prompts that we give you, and you submit that to Everence. The third of the 4 options is eligible pastors can choose to submit their conference accountability or growth plan. And the conferences that currently have eligible accountability plans are Central Plains, Pacific Southwest, and Western District. And if you're interested in your conference qualifying for this option, we would welcome more communication with you and your conference minister. And the 4th option in this part is new this cycle. This is something new we added. And it's an option to spend a day, and by that we kind of mean like a 6-hour minimum, a day engaged in a personal well-being retreat. And you plan your day with well-being goals in mind, and then follow the retreat. Following the retreat, you complete the required form telling us a bit about it, what your focus was, the activities you did in your day. And any one of these 4 options will earn you the additional $150. If you have more questions or you'd like more clarification on any of this, I'd be glad to address that in the question and answer times or from the chat. So. And as I said earlier, our website has the forms you need, and there's more information there as well. So thank you for your attendance today, and I look forward to ways I can connect with you.
Great. Thank you, Ingrid. And thank you, Pat and Denise, for your sharing. I want to note that in the chat, there is a link to our plan overview. It's a nice 4-page flyer that basically goes through and summarizes all of the benefits that we've touched on here, and will give you more information. And you can also go to our website, which I'm sure we'll get the website link up there at the end of our chat here. There were a couple of